But first, we're looking at some health headlines this morning, including health concerns if you have insomnia. And joining us is our good pal, professor at Northwestern University Medical School and WGN Morning News contributor, Dr. Lauren Streicher. Good to see you again.
Good morning.
Good morning.
All right, so let's start out if you suffer from insomnia.
Yeah, this is big. So there's a study that's been going on for 22 years. It's called Study of Women Across the Nation, and it started tracking women in their early 40s and follows them throughout the lifespan to see what things are good for them and what things are bad for them. And one of the things that they've been looking at is sleep. And this study was released last week, and it was huge because what it showed is that women that get poor sleep consistently, 5 hours or less, have a 70% increased risk of having a cardiac event, like a heart attack or stroke. And 50% of women midlife are getting lousy sleep as a result of sometimes, hot flashes or maybe a sleep apnea or the snorer in the bed next to you or, lots of reasons. And we've always known it's had an impact, but this is much bigger than what people thought. So the bottom line is if you're not sleeping, this is important. Get yourself to a sleep clinic, get a sleep study, see what's going on, and fix it because it's going to have a big impact.
All right.
All right, next topic, sugar and restless leg syndrome.
On the topic of things that keep you up at night, restless leg syndrome is something that a lot of folks have throughout the life. It's not just a midlife thing. And people that have this know what it is. Basically, you're in bed and suddenly you just have this urge to keep moving your legs. And while it's not always painful for some people, there's throbbing and tingling. And there's really no good solution for this. They've tried a number of different drugs and some work and some don't work. But a report came out a week ago that got my attention because it's anecdotal. It's not a lot of data, but it was really interesting that if you eliminate sugar from your diet, that you may actually eliminate restless leg. Now, normally I don't like to talk about things that don't have really strong data behind it, but I figure, okay, it's good to get sugar out of your diet anyway, and it's worth a try. So I'd love for people out there with restless leg to give it a try and let me know on Instagram or whatever if it's working for you, because I want to find out.
All right, this one is a new belt for women post-menopause?
Yeah, this goes under the heading of not so fast. Basically, this is a belt that you wear around your waist, which is supposed to vibrate, and the vibration is supposed to decrease bone loss in your lower hip and in your lower spine, which is important for women that have osteopenia, low bone mass. And the only reason I'm even talking about it is because the FDA just cleared it, and there's a lot of buzz about it, so they're going to start advertising. It's going to be out there. It's $800, and the data is really not all that exciting. I mean, it doesn't build bone. It kind of, slows down the loss a little bit, but quite frankly, you're much better off taking a walk, hormone therapy, doing some high-impact weightlifting. I ran this by a couple of osteoporosis experts to see if I was correct, and they're going, yeah, we're not too excited about either, and we can't imagine why the FDA was so quick to clear it.
So do they just clear it, meaning it's not going to kill you? Is that therefore, their threshold?
That's exactly it, because there's a difference between FDA approved, which means that you have to demonstrate that it is safe and effective, as opposed to cleared, meaning if you put this on your face won't burst into flame and nothing terrible will happen, but you can still put the XYZ cream on your face and say it makes me look 10 years younger, and the FDA doesn't say you have to prove it. So.
I see. All right, how about this study about putting the toilet seat down before you flush?
All right. Come on, were you not told? Always put that lid down so that the nasty stuff doesn't spray all over.
I was not told.
I was not told.
I wasn't either, but evidently a lot of people have been, because I put this out there on social media. Everyone's like, yeah, everybody knows that. You put the lid down so you don't get the bacteria on other surfaces in the bathroom. So they actually did the study. And what they did was they put some bacteria in the toilet water, harmless stuff, but something that was easy to track. And then they flushed with the lid down and with the lid up. And guess what? It didn't make any difference.
It didn't?
No. They had the same amount of bacteria that sprayed throughout, and the most nasty place where you're going to find most of this bacteria is on the bottom of the toilet seat, and the lid's not going to make a difference with that. So what does make a difference is with putting the antibacterial stuff in the toilet bowl, the stuff that turns the bowl blue or whatever. That's going to kill 99% of bacteria. But the big question is does it matter? Do we care if a little bit of this bacteria gets out there? And the answer is no. Unless someone has Salmonella, Shigella, some gastrointestinal nasty bug, it really doesn't matter. So don't get crazy about putting the lid down.
Okay. Well, good
Need
stuff.
to know info, right? I know you were really waiting for me to report on that one.
I love it. You can check out Dr. Streicher on social media. Thanks for being here.
Thank
you. Time for On Town.
Hey, Anna.